So babies can be born with high palates. Babies can be born with shallow palates. The purpose of a baby going down the vaginal canal is so that the head can compress. Hi, I'm Dr. Ludeman from Bolingbrook Family Chiropractic. Today I'm going to be reading off some of the comments that we get on our Instagram stories and our Facebook Messenger. So we got a question that said, is it normal for breastfeeding to still feel hard weeks after a tongue tie release? And the short answer is yes. That tissue does not separate in utero until about 4 to 6 weeks, and that comes from the neural tube cells. So that tongue tie is midline tissue. That tissue is supposed to separate somewhere between 4 to 6 weeks. Most parents don't know that they are pregnant until 6 weeks or later. So there's really nothing that you can do once you're pregnant in order to prevent that tongue tie from happening. And that can be from genetics, it can be from MTHFR gene mutation, that can be coming from what is mom's diet like, how do we methylate or not methylate folate. There's a lot of other factors that go into what predisposes someone for a tongue tie. However, because that happens at 4 to 6 weeks in utero, that means that baby is spending this time for the rest of the 9 months in development, one, in flexion, because that's where they're supposed to be. And then if they're in optimal position, that's great. But say baby is transverse, or baby is breech, or say that baby is sunny side up and their head is stuck up in extension, they're going to have faulty motor patterns before they are even born, because that tissue is restricting them from being able to get the tongue up to the roof of the mouth and up into the palate. And that pressure of the tongue up into the palate creates a negative pressure system, also makes the palate separate. So babies can be born with high palates, babies can be born with shallow palates. The purpose of a baby going down the vaginal canal is so that the head can compress with thinking contractions and in the canal. So that can be helpful in the shape of the head. But again, if your baby is born via C-section, which we understand there are many reasons why kids can be born via C-section, but they don't get that pressure system that they're going to get from the contractions and the vaginal canal. So that can lead to cranial bone misalignment, that can lead to dysfunctional motor patterns. So they can still have pain or dysfunction at the breast. Going and releasing that tongue tie, whether you do that in week 1 or if you wait until 12 weeks or you wait until 9 months, you're just compounding time under tension with those faulty motor patterns. So just because you get your tongue tie release doesn't mean that it's going to go away right away. We still have to retrain the tongue. We still have to release the fascia. We still have to fix those cranial bones. So we have all these other things that lead to those dysfunction. And that is why getting chiropractic care, seeing myofunctional therapy, seeing a cranial sacral therapist pre and post release is going to get your family the best outcome. So yes, long answer. You will see that you could potentially still have pain at the breast post tie release if you're not doing that pre and post body work.